Dr. Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Simply Avante. Always forward. Dr. Mendoza.
What's going on, my man, Evan?
How you doing, my friend? You doing
great?
Good?
Quarantined up.
You know, we're training partners. We're training brothers. We study a martial art called Kali. It's a Filipino weapon system, and that's how we really got to know each other, right?
Yep,
you know,
absolutely.
I'm a huge fan of yours, and not only from a personal, like you're good friends, but professionally, you're such a unique physician, and I wanted people to learn more about who you are, what sets you apart, how you're so unique, and can you please just explain to us like what's your specialty and what you do on a day-to-day basis, because you're basically a superhero to me. So tell me what you do.
So basically, my specialty is called physical medicine rehab. The technical term is a physiatrist. A lot of people are not familiar with that actual term. So my training in a physiatry residency, we treat a lot of patients and deal with the rehabilitation of people that have neurologic injuries from things such as strokes. Even people that have cardiac issues. So some people that have had like congestive heart failure, or who have had heart disease, or have had heart surgery, they'll need rehab afterwards under monitored care. But that's kind of part of our residency. A bulk of the patients that I see now in outpatient care are mostly people with like neck and back issues, other joint issues, and I'm basically trying to treat them without surgical intervention. So I'm treating them by sending them to folks like yourself that are doing physical therapy for them, getting chiropractic care, acupuncture. But I also do injections as well. So that's another part of my practice. But if I can, I prefer not to do injections. I'd like to see people, be able to, use their own ability to improve and just kind of help guide them along that path.
And what inspired you to become a medical doctor? It's not easy, right? I mean, you have to get great grades in high school, and then to be able to apply to get into college, and then to get into college, and get into medical school. Like, what is your motivating factor?
Yeah, I think one of the biggest things is like I love learning. I'm like just like Evan. Like I know he's a guy that is really passionate about helping people, but also about learning. Even kind of going back to our martial arts background. It's a lot of like layers and layers of things, but we enjoy that. We enjoy learning these little things about just stuff, and I love science, and I have since I was a kid. And it was one of those things that just every year we just kept building up and building up, and like I love that. I love learning things, and science is an awesome thing. And I really was drawn to medicine, and being Filipino, like we were always told as kids, we were always, our parents were always kind of stressed how important it is to not just think about yourself, but to also help other people. And medicine is a great way to not only satisfy that urge to learn and learn about science, but also to help people and be more than just someone for yourself, and be someone for others as well. So that's really important.
Now, were your parents heavily involved with growing? Were they big into like learning and having that hunger? Because not every physician has the hunger you have, right? I know that you're stuck inside. You probably read 25 books since you've been home, right?
Yeah. No, it doesn't stop, man.
Not everybody's like that. Like even like in my career too, like physical therapists and acupuncturists, and they don't put the extra time in like you do. Where'd you get that from?
That's a good question. I mean, I think part of it came from my parents. My mom was a teacher. She was a preschool and pre-K teacher for probably like 25, 30 years, something like that. And again, both my parents were also immigrants too, so that's also a big thing.
There you go. Yeah.
So when you come from an immigrant family, it's like it's tough. I mean, they came with not a lot. But they worked really hard, and they were able to, kind of provide a pretty good situation for myself and my sister. But you see that, like, even when you're a kid, you realize, like, maybe I'm like maybe a little bit different, So and you kind of, I think they kind of instill that hunger in you, like you got to work a little bit harder maybe than some other folks, because otherwise, yeah, you're not going to survive, right? So. And then also, like, kind of being able to go back to the Philippines many times, like, since I was a kid to even a couple years ago, you kind of see where my parents grew up, and kind of the struggles that they may have had back there, and makes you appreciate things more, makes you want to work, and want to do good things, so.
Yeah, I see that. Like, you have a servant leadership approach to how you treat patients.
Mm-hmm.
And I saw that from the beginning. Once we met each other, it was like kismet.
Yeah, no, absolutely, man, absolutely. No, as soon as we met, we hit it off right away. No, I think you can tell, like, the people that really kind of care about what they're doing, and the kind of the folks that are in it because they want to see people doing well, so.
Thank you. And why do you refer your patients to us, and why do you like us? Like, what sets us apart? What's unique on our end that you appreciate and that you respect?
Yeah, I mean, I think kind of goes back to that first time that we met. I had a couple interactions with some other folks from Kinetic, and I haven't I just we kind of met in passing a couple of times. And then Evan came in one day, and he really just, like, kind of blew me away. Like, you very knowledgeable, could tell right away that you were passionate about what you were doing. We just kind of talked, like, I'm a huge, like, Stuart McGill fan, and you were very knowledgeable about that, and a lot of people aren't. And so that really, like, kind of blew me away. I was like, okay, if I send people to Kinetic, they're going to get taken care of. And it didn't stop there. Like, once I started sending folks over to you, to your practice, my patients got taken care of, and it was like a really, one after one, like, I mean, like, one after the other, they would come in and say, oh man, I had a great experience at Kinetic. I remember one patient in particular. I mean, she was a woman, like, in her 70s, very active. She liked to go dancing. And she just had miserable experiences in physical therapy before. She was really down on going. And I said, no, you got to just try it. Just, go to Kinetic. I think it's going to be a little bit different. And absolutely it was for her. I mean, she really enjoyed her physical therapy. She got a lot better. And it wasn't one of these things where, I had to give her, like, a lot of medication or anything like that. And it really absolutely wasn't. I mean, the only thing I prescribed to her was physical therapy. I said, go see my friend Evan over at Kinetic, and surely enough, she did get better. So in this kind of environment, it's like you kind of get a sense of who's doing right by your patients, and that's how you develop those good relationships, and that's why I send people over to you.
Agreed. It's not always how much you know. I think it comes down to how much you care. Yeah, knowledge.
Absolutely.
Anybody
Absolutely.
can learn a technique or a strategy, but you can't teach how to serve others.
Right.
I think that's what you do a great job of. I think that's the culture of our company. I think that's why we've been able to really mind meld, and we just connect well with each other.
Yeah, I think the other big thing I wanted to mention too was that especially with Kinetic and Evan, for me and for most pain physicians, we know that it's not just going to be like an injection, or you can't just, it's not going to be a doctor's visit. It's very little that I do a lot of times. I know that for someone to optimize their health, I mean, there's multiple aspects of what goes into what causes their pain. I mean, there's a lot of folks that are going to be overweight. They just don't have any idea of what a good diet is. They don't have a good exercise program. They don't necessarily have, a lot of times they have the will, but sometimes they just, they don't have a good education on what is a good exercise program. So, I rely heavily on good, physical therapists and folks like Evan, to be able to, get those messages across to them. And another thing that I love, kind of thinking back to it, like maybe a few months ago, before all this COVID stuff was going down, Evan actually was giving some talks about dieting, and which I tried to send some of my patients to, because that's a huge part of pain as well, and part of people's rehab. If they're not eating properly, it's going to make it awfully difficult for them to get better. So that's the thing I love about Kinetic. I mean, you're not just going to go there for physical therapy. I mean, there's other aspects that they're going to be helping you to address there as well. So
Yeah, I think because we believe in your health is a direct adaptation to your lifestyle choices.
absolutely.
So we're always educating your patients how to eat well, how to move well, how to think well, and then how to supplement well.
Absolutely.
And if we're missing one of those four pillars, I mean, you could get all the best manual therapy in the world, the best injections. If you have a chronic inflammatory state to maybe IBS or ulcerative colitis, you're going to have somatic reflex, and
Right.
it's going to cause pain. It's not going to get better.
Right.
Or you might decrease the inflammation in the body, but they have a disc bulge. It's not going to change their symptoms. You know, so they have to work synergistically with each other, you know?
Absolutely. Absolutely.
Yeah. Well, thank you so much, Dr. Mendoza. You know, I'm such a huge fan. You're my brother. I'm hoping that using the knife I gave you.
That's right.
Yeah. So the audience knows we actually play with knives a lot. And is it right next to you? Do you have it?
I do actually. It is actually right next to me.
That is hilarious.
So it's never too far. So so Evan looks like a very pleasant man. He is a pleasant man, but he's also very dangerous. So don't get on his bad side. He's probably carrying a weapon.
Well, it's because we have great teachers. That's it.
Yeah, absolutely, absolutely. Shout out to Master Ace and also Tuan Apollo.
Tuan Apollo and Crew Chris and Coach Figs.
Yep, absolutely. The whole team.
Shouts out to everybody.
Yep.
But, you know, I can't wait till I see you again, my friend. And I can't wait till the pandemic's over so we could give each other a hug.
Yeah, absolutely, man. Miss you.
All right, brother. Thank you so much. And thank you so much for your time.
Okay.
And we got to do this again because I think that you have a lot of knowledge that you can share with people that help them treat themselves at home. You know, so we'll try to set up another video.
Yeah, absolutely. Let's do it.
All right. I'm also I'm launching my product line. My first two products I'm launching are Vita Sleep and Vita Calm. It downregulates the sympathetic, so it allows people to sleep deeply and activates theta waves, brain waves. So it calms the mind and puts you into deep sleep. I'm going to send you 2 samples so you can enjoy it.
Okay, perfect. I'm not a very good sleeper, so I think that'll help.
Yep, that's why I started with those 2 formulas because nobody is.
Okay, perfect.
All right, brother. Thank you so much for your time, man.
All right, take care, Evan.
All right, take care. Bye-bye.